The reason we're here today really is to help people understand a little bit more about inclusion health. So in healthcare, sometimes we can provide services within quite rigid eligibility criteria that don't necessarily work for everyone. So really today is all about spreading that learning that we've got, but also giving people the tools, I guess, to understand what they can do proactively within their services to make them more flexible and inclusive.
There are particular groups who have such poor health outcomes. We have groups in our society who are dying 30, 40 years earlier than others. And actually I feel that real sense of imperative to find ways forward, because we need to reduce some of those extreme inequalities, to resolve and think about how we do services differently. We have to have that informed by experts, by experience, by people who walk that walk.
I think if they don't listen to us who have actually lived it, they're not going to learn anything. So it's important for us as service users that all these professionals, get a better understanding of it and sort of work together better.
First and foremost, I'm a midwife. So the reason today that today is so valuable and what I'm hoping to get from it is collaborative working, and I see that, and I see the passion in all the different topics. We should all share the common goal of wanting to do better for the people that we serve.
So many of us don't realise all these different organisations are doing this kind of work, and there's lessons to be learned from all of them, and so it's really inspiring to actually pull them all together and actually hear the professionals' experience, but also how they've actually pulled in the opinions of the actual people who are experiencing those difficulties in order to shape those services. And the more that we hear about these kind of examples, the better really.
How would you rate your understanding of the needs of inclusion health groups? And I can see that people are starting to fill this out as we go. So
you can't change a whole system at once. It's like turning around a juggernaut. You have to, it requires a lot of collaboration, a lot of collective effort, but actually each individual plays a part in that. And if you have just one example of, where you can talk about how you've worked differently to include somebody, then sharing that example with other people then builds momentum, where actually there's a sense collectively we can do something. Day by day, choice by choice, interaction by interaction, we can all make a difference if we choose to.
We're here to improve people's health outcomes. That's ultimately got to be the goal. But secondly, I think it's about also enabling our workforce to feel really empowered. And I think people should take a step away and congratulate themselves actually on a brilliant job that they do in a really, really difficult circumstances. So the one thing I really want people to walk away with is an understanding of one practical thing that they can do that enables us to work around people's needs.